Hi, Assalamualaikum. Let's learn about infertility with us. So, we are from Group 2, TSP4. Our group members consist of Intan Alia, Aisyah Nabiha, and me, myself, Intan Kushuhada, and the last one, Nur Soleha.
So now, I will explain what is infertility. Infertility refers to the inability to conceive a child after a year of unprotected intercourse if under 35 or 6 months if over 35, despite regular sexual activity. Next, there are two types of infertility, which is primary and secondary. Primary infertility is when a pregnancy has never been achieved by a person. Secondary infertility is when at least one prior pregnancy has been achieved.
In 2022, the total fertility rate in Malaysia was approximately 1.6 births per woman against 15 to 49 years. The total fertility rate decreasing year by year indicates that fertility rate among Malaysian women is getting critical.
Alright, what leads to infertilization? Infertility may happen because of a health issue with either you or your partner or a mix of factors that prevent pregnancy. Although both women and men can experience infertility, women in a relationship with a man are often perceived to suffer from infertility regardless of whether they are infertile or not. In the female reproductive system, infertility may be caused by, first, uterine disorder, which could be inflammatory in nature, such as endometriosis, or congenital in nature, such as septate uterus, polycystic ovarian syndrome, and other follicular disorders. Second, certain cancer, especially ones that affect the reproductive organs, often reduce female fertility. Both radiation and chemotherapy may affect fertility as well. Lastly, tuber disorders such as blocked fallopian tubes, which caused by untreated sexually transmitted infection, STIs, or complication of unsafe abortion or abdominal or pelvic surgery. How about male? Infertility in male can be caused by obstruction of the reproductive tract, causing dysfunctionalities in the ejection of semen, can occur in the tube that carries semen, such as ejaculatory duct blockage, are due to injuries or infection of the genital tract. Second, amount of sperm is made and the quality. These medical conditions can include undescended testicles, genetic defect, hormone problems, and health problems such as diabetes, chlamydia, gonorrhea, and HIV. Enlarged veins in the scrotum, called a variococcele, can also affect sperm's quality. Third, lifestyle factors such as smoking, excessive alcohol intake, and obesity can affect fertility. In addition, exposure to environmental pollutants and toxins can be directly toxic to gametes, resulting in their decreased number and poor quality.
So, the treatment that we chose is intrauterine insemination, IUI. It is a fertility treatment where sperm are placed directly into a woman's uterus. So these are the procedures involved in intrauterine insemination treatment. So the first one is tracking of ovulation cycle. The second one is preparation of semen sample. And the last one is injection of the prepared sperm. The first procedure involved is tracking of ovulation cycle. So the first one is finding the time of ovulation to inseminate and fertilize the egg. The timing of ovulation is critical to make sure the sperm is injected at the right time. And the second one is the healthcare provider can also detect LH in blood tests. They may also use transvaginal ultrasound to look for signs of mature eggs. And the last one is sometimes patient is given an injection of HCG or other fertility medications to make patient ovulate one or more eggs. Secondly, preparation of semen sample. Male partner provides a fresh sperm sample on the day of the IUI procedure. If the male patient can provide the sample before, the healthcare provider can freeze it until it is time to be used. If sperm donor is used, the sample will be thawed and prepared. Lastly, injection of the prepared sperm. The female patient has to lie down on the exam table. The healthcare provider will insert a speculum into the patient's vagina. Next, a catheter is inserted through the cervix into the uterus. Finally, the healthcare provider will inject the washed sperm sample into the uterus.
Next, we move to Quranic verse. The teachings of the Quran have emphasized the vital role of the institution of marriage and the family structure, and inseparable from this is the act of procreation. Now, let's listen to the Quranic verse regarding the infertility treatment.
والله جعل لكم من أنفسكم أزواجا وجعل لكم من أزواجكم بنين وحفدة ورزقكم من الطيبات أفبالباطل يؤمنون وبنعمة الله هم يكفرون.
So now, I will explain fatwa regarding the infertility treatment. In Islam, when a couple cannot have children naturally, they are encouraged to seek medical treatment for infertility. Adoption is not preferred, so using medical help to conceive is seen as a positive step. The duty of the physician is to help a barren couple achieve successful fertilization, conception, and delivery of a baby. IUI is one of the assisted reproductive technologies, so all assisted reproductive technologies are permitted in Islam as long as the semen source, ovum source, and the incubator come from the legally married husband and wife during the span of their marriage.
Let's explore about ways to increase fertility. Firstly, is by reduce stress level. There are many ways to reduce stress level, and one of them is by practicing mind-body techniques such as yoga, meditation, and cognitive behavioral therapy. These techniques can help manage anxiety and depression, fostering a more positive outlook on fertility treatments and outcomes. Secondly is dietary changes. Start by focusing on fertility-boosting nutrients such as iron-rich foods, for example, meats and beans, and folate-rich foods, for example, leafy greens and citrus fruits. These nutrients are essential for ovulation and pregnancy. Lastly is exercise regularly. Moderate physical activity helps to improve blood flow, which are beneficial for fertility. Exercise increases blood circulation throughout the body, including to the reproductive organs. Improve our blood flow ensures that the ovaries and uterus receive adequate oxygen and nutrients, which supports healthy egg production and uterine lining development.
To sum up, every human being has a right to enjoy of the highest attainable standard of healthy physical and mental. Individuals and couples also have the right to decide the number, timing, and spacing of their children, while infertility can negate the realization of this essential human right. Hence, infertility issue can be overcome by exercising regularly, reduce stress level, and dietary change. It is essential to make sure that institution of marriage and family structure is successful, as Allah mentioned in Surah Rum verse 21. In Islam, action must be taken to conceive the problem. One of the treatment can be used is intrauterine insemination (IUI), one of the effective treatment that can cure the disease. By being concerned with what causes infertility, the solution, and the treatment, the increasing number of infertility in Malaysia can be remedied, hence, number of population can be maintained at a normal state. That's all. Goodbye.